Hello everyone, welcome back to Learn with Nurse Grace. So if you're just coming across this channel, my name is Grace Ezekia. I'm a registered nurse who is currently in the United Kingdom, but originally from Kenya. If you've just come across this channel, please make sure that you subscribe to this channel. Thank you so much for those who have already subscribed. Thank you so much for those who are there to watch me. So today I'll be discussing about the signs of ovulation. I've got people who have been asking what signs to look for when they're ovulating. You know that ovulation is a very crucial moment because it's this time that you find most of the people who are actually trying to have a baby. This time is when they try most, and that most of them actually have babies during this time. And it's actually the period when you should try to have a baby. And those people who are trying to avoid being pregnant, this is actually the period that you should know in order for you to try and avoid unprotected sex. So let's get to the video. So what is ovulation? Ovulation, in simple words, it's when or it's a process in which an egg or an ovum is released from the ovary. During this ovulation, you know, when a woman is born, when a girl is born, she or he is born with all the eggs that she is going to be releasing from puberty until when she or he gets to menopause. In other words, you are born with all the eggs that you're supposed to have your entire life. So during each time of ovulation, you shed each and every egg, and it means that the older you get, the lesser your eggs become. Ovulation is when the egg is being released from the ovum towards the fallopian tube, and when it gets there is when it's waiting for the sperm in order for it to be fertilized. So what are these signs of ovulation? And before I get to the signs, I would like to tell that we've got a cycle. When I'm talking about a cycle, it means that there are those people who've got 21 days, there are those who have 28 days, 25, but a normal is between 21 to 35 days. And in general, like most women have about 28 days, and you find that ovulation basically normally happens on the 14th day. So I'll do a video to explain on what are the safe days for you to have unprotected sex, and what are the fertile days for those who are actually looking forward to having babies, the time that they can really engage in unprotected sex for them to make babies. So I'll also do a video on that. But for today, I'll just like to let you know on the signs of ovulation. So most people actually don't know when they're ovulating, and me making this video is just going to give you detailed information on how you can identify if you're actually into your ovulation. And there are also many things that can make you have these signs, but for today I'll just focus on these specific signs. So let's get to the video. So the first point is changes in your cervical mucus. So you know, if you're a lady, definitely you know that we have this discharge that usually comes maybe throughout the cycle, and you find that throughout the cycle this discharge keeps on changing. When in order for you to know that you're ovulating, you'll find that if you want to try and get this discharge, or you can just try to clean your hands with soap and water. Make sure that your hands are very clean, and you can try to sit very well or squat and insert your finger into the cervix. When you just get to the cervix and try to remove your hand, you can come out with the mucus. When you come out with the mucus and try to like stretch it, you'll find that it's a bit stretchy. The mucus is a bit stretchy, and it forms like a string like, and it's very sticky. So that's when you know that and it looks like the egg white, let's say like the egg white. So when you do like this, it's like a bit stretchy, so it's very clear. And you can find that during the normal days, the other days, you find that your discharge is not like the same as the one that is normal, like the one that happens on the ovulation day. If you're that person who like monitors their discharge, you can easily identify the difference in this discharge. The discharge is very, when you do like this, it's very like it opens up like a string, and it's very sticky, and it's very clear. So that is when you know that you're ovulating. The second sign is breast tenderness or breast sensitivity. If you're that person who have been monitoring your breast throughout the cycle, then you'll find that during this period is when your breasts are very, very tender. When you try to touch even the nipple part, is when you find that the nipple comes out very prominently, and it's very, very sensitive. Even to touch, you can feel a bit painful, a bit of fullness. When you experience this, just know you're on your ovulation. another thing is basal body temperature, changes in basal body temperature. So how do you do this basal body temperature? You can use a thermometer to measure your temperature. And the meaning of this basal body temperature, it means that this is the temperature that you're going to be taking early in the morning, in most cases early in the morning. And I would encourage to do it while you're still in bed, because the minute you start doing other things while you're in the house, like you start maybe cleaning and maybe cooking, then your temperature changes automatically. If you've been monitoring your temperature, let's say like from the start of the cycle, then you'll easily identify the changes in your basal temperature. It's going to be easy for you to identify the changes in your basal temperature when you do it like the whole month. It doesn't mean like when you get to the 14th day or maybe the 15th day, depending on when your ovulation is going to be, is when you're going to be starting to look at your temperature. If you do that, then there's no way you're going to be noting on the changes. There's no way you can know the changes, because you don't have anything to compare with. But if you've been doing it from the first day of your cycle to the ovulation up to the end, then you can know the difference. The fourth thing is heightened sense of smell. So what do I mean by this? This means that your sense of smell, you are able to smell a lot of things and very easily. Like even when someone is just preparing something like maybe a food or maybe like perfumes, you're able to smell them from a very far distance. So if you've got this thing that comes on and off, then know just that during this time period that it comes, you must be ovulating. Then the next point is about your cervical changes. If you're also the person who keeps monitoring your cervix, then you can easily note this by just trying to wash your hands with soap and water, making sure that your hands are clean, and trying to insert your hands into your cervix. When you insert your hand into your cervix, just try to press your nose. If you're not ovulating, then you know your cervix, the tip of the cervix is normally as firm as this tip of the nose. It's very firm. But during ovulation, the cervical tip is very, very soft. And why is it soft? It's soft because it needs to allow the sperm, it needs to give the sperm a conducive environment for it to go through. And even in these changes, even another change is that during this specific time of ovulation, you can find that your cervix is a little bit open. If you've also been monitoring, during the normal days, the cervix is so closed. Even if you try to like insert your finger, then you can't like really insert a finger into it. But during this period of ovulation, it's a little bit open so that it easily allows the sperm to get in and go and fertilize the ovum. Another point is spotting. So why do we spot? You can find that honestly, I've never had any spotting myself, but I've learned, and according to some books and according to even some of my friends, they've been telling me that during this period of ovulation, they tend to be spotting. And people have been asking what is the reason for them to be spotting, because even someone, when he starts spotting at that time, she might think that it's the time that she wants to start her menses, but it's ovulation period. So why do we spot? We spot because when this ovum is being released, you know, it's being released because it's inside the follicle. So they have to burst in order for the ovum or the egg to be released into the fallopian tube. So when it bursts, there might be a little bit, just small amount of blood that may come through the uterus towards the vagina, and you might see it even into your pants, or maybe if you've got pads on or something, you might see just a little bit of it, just some few drops, 1 or 2 drops. There is a possibility that you may see it. But if the bleeding is too much, that it's not spotting too much, then it's high time for you to go and see a doctor. So the 7th point is about nausea and vomiting. So I think I've experienced it once or twice. I can't remember, but maybe it comes and goes. But there are other people who might experience this nausea and vomiting during this time. The next point is mild pelvic cramping. This pain comes on one side. For me, I experience this every month. I experience this cramping every month. So you can find that this month is this time, is this side, and then the other month is the other side. So that's when I know that it is actually ovulating, because it's a very, very bad pain and it's just one-sided. When I was just starting my period, so at this point I used to think maybe I've got an issue on each side, because maybe you might find that this side is the left side, the other side is the right side. But but you find that there's this cramping on the lower abdomen, and it's just one-sided. It's a mild cramping, and there are those people who like take medication to ease the pain, and normally you can just have some rest and drink plenty of water and you'll be fine. So that is another sign of ovulation. This cramping basically occurs when the egg is actually moving from the ovum itself to the fallopian tube. That's when you feel the cramping pain. So the last point is positive ovulation test. So there are those people who actually do the ovulation test, especially for those people who are actively trying to conceive. They buy like this ovulation strips in which they try to do their test in order for them to find out when they're actually ovulating. So if the ovulation test comes out positive, definitely it's a sign that you're ovulating. Thank you so much, guys, for watching this video. If you haven't subscribed, please make sure that you subscribe in this channel so that we can continue sharing this knowledge and we can get to learn more. Thank you so much. See you in my next video. Goodbye.